How to reduce fever in cats. Whether it's you or your cat, having a fever isn't necessarily a bad thing. It's a normal immune response that helps the body recover from illness by killing heat-sensitive bacteria. The heat from a fever also increases blood flow to injured tissues to help repair them. However, there are instances in which fever is dangerous. If your cat is sick with fever, you can help reduce it so she has a quicker recovery. There are also plenty of medications you can consider. Making your cat more comfortable will help her get over her fever and back to normal. Method 1: Reducing fever at home. 1. Recognize the symptoms of fever in cats. The normal range of rectal temperature for cats is from 38.1 C to 39.4 C, 100 to 102.5 degrees Fahrenheit. If you can't easily take your cat's temperature, the following symptoms could indicate a fever: poor appetite, lethargy, inactivity, weakness, excessive shedding, withdrawing away from other cats, rapid or shallow breathing, shivering, decreased grooming activities. Because most fevers are caused by an underlying condition, be on the alert for other symptoms such as vomiting, diarrhea, coughing, sneezing, or skin swellings. These could point to a reason for your cat's illness. 2. Take your cat's temperature. Symptoms are a good sign that your cat has a fever, but the only way to know for sure is to take her temperature with a thermometer. You can take your cat's temperature rectally or in its ear. Gather your supplies. You will need a thermometer, lubricant, e.g., petroleum jelly or KY, alcohol and paper towels, and a cat treat. If using a glass thermometer, shake it until the mercury is below the 96 F, 35 C line. Simply switch on a digital thermometer. Use a special thermometer designed for pets to measure temperature in the ear. If measuring your cat's temperature rectally, lubricate the thermometer. Cradle your cat under one arm or ask someone else to hold her. Raise her tail. Insert the thermometer into your cat's anus about 1 inch. Hold a glass thermometer in place for 2 minutes. Remove a digital thermometer when it beeps. Clean the thermometer with rubbing alcohol and paper towels. Give your cat a treat to comfort her. If your cat's fever is over 102 F, 39 C, take her to see a vet immediately. High fevers can cause organ damage. 3. Examine your cat's body. Gently press your cat's body with your fingers. Determine whether you can feel any injuries like bone fracture, swollen lymph nodes, abscess, wound infection, or tumors. All of these instances can cause fever. You may or may not be able to feel a bone fracture in your cat. Fractures or breaks in bones can cause swelling or bruising in the break area. If you apply pressure to the injured area, your cat will respond with pain. Be gentle as you examine your cat. You should be able to feel swollen lymph nodes under your cat's jaw area and around her shoulders. Swelling at the back of the legs or near the groin is also possible. Immediately take your cat to the vet if you notice any of these symptoms. These conditions require prompt medical attention. If you do not notice any of these symptoms, the fever is likely a normal immune response. If possible, get your cat examined by a vet who will try to identify the source of the infection. Follow the steps below as directed unless your cat's fever has been present for over 24 hours. If your cat has had a fever for more than 24 hours, seek veterinary advice and treatment as soon as possible. 4. Help your cat cool down. Cats lose heat through sweat glands in their paws and by panting. Help your feverish cat cool off so you can reduce her body temperature. Find a cool, dark room, preferably with a slate or tile floor so that she can stretch out and transfer her body heat to the tiles. You can also try these ways to help your cat cool off. Position a fan on the floor so that it blows cool air over her body. If your cat will tolerate it, gently wet her coat with water. You can use a damp cloth or a spray bottle to dampen her coat. The evaporation will help to cool her body. 5. Provide plenty of water. Fever can be caused by dehydration, and can also cause dehydration. It is important that you provide fresh water at all times to your cat. If your cat is having trouble drinking, provide your cat with water via syringe, without a needle. Rehydrating your cat can reduce fever. This is the reason why cats are given 4 fluids at the vet's clinic. A feverish cat will not want to get up and walk about, so make sure she has drinking water within reach. You can sponge her gums with tepid water. In addition to water, you can also give Gatorade or children's electrolyte solutions to cats with fever. These may help restore your cat's electrolyte balance, especially if she has been vomiting or had diarrhea. You can use a syringe to get your cat to drink Gatorade. If your cat is resistant to syringe hydration, try freezing some water or Gatorade into cubes. Your cat may be more interested in licking an ice cube than drinking, and the cold will help her cool down. Never give your cat milk. Cats are very sensitive to lactose. Milk can make your cat ill and cause nausea, vomiting, or diarrhea. 6. Make sure she's eating. Fever requires huge amounts of energy and can leave your cat very weak. Your cat may not feel up to eating solid food. You can supplement her diet by providing soft foods. Soft scrambled eggs or canned tuna run through a food processor can be good options. If your cat refuses solid or soft food, try using a syringe to feed your cat milk replacer, sold at pet stores. This is a food that's designed for feeding sick cats or nursing motherless kittens. Use a syringe, no needle, with 5 cubic centimeters to 10 cubic centimeters capacity. Insert the tip of the syringe on the insides of corners of the mouth, closest to the cheek. Cats and dogs will swallow by reflex anything that has passed in this area inside the mouth. If your cat cannot eat, ask your vet about high-calorie liquid supplements. Your cat can consume these until she is well enough to eat solid food again. 7. Give your cat vitamin B and energy supplements. It's a good idea to ensure your cat's nutrition by boosting her appetite. Vitamin B, complex and energy supplements added to her diet can accomplish this. A vitamin and energy supplement like Nutri Plus Gel, at 5 ml daily for 5 days, can be given to battle fatigue and a lack of nutrients. An example of a very good B complex vitamin is Coforta. It has a high concentration of cyanocobalamin, 3, which is needed in energy metabolism. It is injected at 0.5 ml to 2.5 ml per cat once a day for 5 days subcutaneously, SQ, or intramuscularly, IM. For small cats less than or equal to 1 kg, 2.2 pounds, 0.5 ml. For cats 2 to 6 kg, 4.4 to 13.2 pounds, 1 ml. For large cats, 7 to 9 kg, 15.4 to 19.8 pounds, 2.5 ml. For cats between these weight ranges, estimate a dose between these or follow vet advice, erring toward a lower dose. Never give your cat supplements with the following ingredients. They can be toxic to cats. Garlic or onion, calcium, vitamin D, vitamin C. Method 2: Reducing fever through medication. 1. Take your cat to the vet. If your cat seemed well but was running a fever, after 24 hours take her to the vet. If she was off color and running a fever, don't wait that long. Extended high-grade fevers can be a sign of more serious health issues. Your vet can perform examinations and tests to help determine the cause of the fever. Be sure to tell your vet your cat's recent history. Information to provide could include travel history, contact with other animals, recent vaccinations or other treatments, allergies, and anything else that you believe may be the cause of your cat's fever. A fever can happen for a number of reasons, including bacterial, viral, or fungal infections, physical trauma, autoimmune disease, necrotic tissue, tumors or cancers. The cause of the fever will determine the treatment. Your veterinarian will need to perform tests to determine the cause of your cat's fever. Common tests include blood work and urinalysis. 2. Use antibiotics if vet recommended. If your cat's fever is caused by a bacterial infection, the underlying infection must be treated. Usually giving antibiotics would be enough to reduce a fever. While antibiotics are generally safe for a cat with a fever, do not self-medicate. Always ensure that the vet has checked and prescribed antibiotics for your cat. Antibiotics are often specific to one strain of bacteria and may not be effective for others. Your vet can recommend the best treatment for your cat. The most common and safe antibiotics usually prescribed by vets are ampicillin and amoxicillin, 20 mg, kg body weight. Both are available in suspension form and can be bought in human pharmacies. Marbofloxacin, 2 mg, kg, is available in tablet form. However, it can be very hard to dose because of its small tablet size. Doxycycline, 5 mg, kg, is available in paste form, and a preparation made for pets can be bought upon prescription of a veterinarian. This preparation is Vibravet, and it comes with a plastic syringe doser to ensure correct administration. In giving antibiotics, the duration of medication should always be 1 week, 7 days. Always give the full course of antibiotics, even if your cat appears to be feeling better. Shortening it may cause re-infection and antibiotic resistance. 3. Ask about meloxicam. Also known as Metacam, this is a useful anti-fever drug that is safe for cats. It is approved for use in many countries. It should not be used except under veterinary direction. The recommended maintenance dose is 0.05 mg kg daily of feline meloxicam, with or after food. A 5 kg 11 pounds cat will need 0.5 ml of cat Metacam. It should be noted that meloxicam is formulated in 2 strengths, for dogs, 1.5 mg ml, and for cats, 0.5 mg ml. It's imperative you give your cat the proper form of this medication to avoid an overdose. Meloxicam should only be used in well-hydrated cats. Dehydrated cats may well have impaired renal function. The additional decrease in blood supply to the kidney may cause kidney failure. 4. Ask about tolfenamic acid. Tolfenamic acid, or tolfidine, is an NSAID anti-fever drug. Tolfenamic acid comes in 6 mg tablets. The correct dose for tolfidine is 1 tablet, 6 mg tablet, for 3 to 5 days for every 1.5 kg, 3.3 pounds, body weight once a day. Tolfenamic acid is not FDA registered and is not a first-choice painkiller for cats. It is therefore used relatively rarely and only under veterinary supervision when other drugs have failed to work. An average cat with a body weight of 4.5 kg, 9.9 pounds, would need around 3 tablets of this medication to be given in a day. 5. Use aspirin only with vet supervision. Aspirin is not the anti-fever drug of choice for cats. It can cause dehydration, vomiting, and other severe symptoms. Aspirin can be used in a cat with extreme caution if recommended by your vet. Give only the recommended dosage. The recommended dose for a cat is 2.5 mg kg, 5 mg lb, every 48 to 72 hours. Use pediatric aspirin, which usually is available in 50 mg or 75 mg tablets. This will facilitate smaller doses. Give your cat food and water with aspirin. Giving your cat aspirin on an empty stomach may make your cat feel ill. Once absorbed across the stomach lining, aspirin is broken down to salicylic acid. However, cats lack the enzyme necessary to break down salicylic acid. Salicylic acid levels in your cat's body will remain high for prolonged periods. High and/or additional doses rapidly lead to toxicity. Thus it is incredibly important to monitor the dosages you're administering. 6. Know that cats cannot handle certain human medications. Reducing fever in cats is different from other animals because of their physiology. Cats lack an enzyme in the liver called glucuronyltransferase. This means that they cannot break down many medicines that are safe for humans. In many cases, even medicines that are safe for dogs are not safe for cats. Do not give your cat any medications intended for humans unless they have been specifically prescribed by your veterinarian. Doing so can harm or even kill your cat. Tips. If your cat refuses to eat or drink, take her to the vet. These are signs that your cat needs medical help. Do not give aspirin to your cat unless your vet has given you an exact dosage. Cats are extremely sensitive to aspirin. If you give your cat the wrong dose, you could make her sicker. Warnings. Be careful not to do more harm than good. Use extreme caution when giving human medications to cats, since the majority are extremely toxic to felines. Follow the dosage instructions given by your vet. Seek veterinary advice if your cat runs a temperature above 39 degrees Celsius 102 degrees Fahrenheit, or if he remains feverish for more than 24 hours. If you are in any doubt about whether a medication is safe to give your cat, err on the side of caution. Consult with your vet about what medications to give your cat.